Acute parvovirus infection. The patient is a 10-year-old female active in dance classes. She is referred to the rheumatology at UMPC following a week-long bout of malaise, accompanied in the last several days by a pruritic lacy rash on her trunks and limbs. An anti-nuclear antibody ANA assay obtained by the outside physician at an outside laboratory was positive to a titer of 1 to 1,280. In presentation at the rheumatology clinic, the pruritic lacy rash is again evident on the trunks and limbs. No photosensitivity or appearance of malar-type rash is appreciated. The patient is afebrile and reports no significant constitutional symptoms. On physical examination, the oropharynx is normal and no splenomegaly is appreciated. She provides additional history of exposure to parvovirus and Epstein-Barr virus in dance classes prior to the onset of her recent illness. There is no family history of rheumatologic disease. Believing this condition to represent infectious disease versus early rheumatologic disorder, given the high titer positive ANA, additional laboratory studies were obtained. C-reactive protein, complement protein C, and immunoglobulin subtype quantities were within normal limits. Complement protein C4 was below detectable limits. Her complete blood count and differential were unremarkable. Her final diagnosis was acute parvovirus infection. Parvovirus are small, non-encapsulated icosahedral viruses found all over the world. They are separate from many of the other human pathologic viruses and that they contain single-stranded DNA as their nucleic acid. Transmission is typically person to person, although the exact mechanism for dissemination is unknown. Transfusion-associated infection has been documented, but parvovirus is not routinely screened in the blood donor population short of exclusion of donors with a viral exanthem at time of collection. Development of anti-parvovirus IgG following acute exposure is protective through life, although reactivation of persistent infection can occur. So the conclusion is a 10-year-old girl was admitted to the hospital after not feeling well for a week, and she had a rash that appeared a few days prior to her coming into the hospital. Her rash presented on the trunk of her body and her limbs, and she had had exposure to the parvovirus and the Epstein-Barr virus, and her final diagnosis was acute parvovirus infection, a highly contagious disease accompanied by a rash. Some of the big words were rheumatology, which is study of rheumatism, a disease characterized by inflammation of the joints and muscles, splenomegaly, which is an enlarged spleen, dissemination, which is to spread or disperse, and then exanthem is an eruptive disease.